Hello everyone, welcome back to Sowkya Vision. Today we are going to discuss the elbow joint. Yes, the elbow joint connects the arm and the forearm region. Yes, the elbow joint containing two main articulation between the humerus and the ulna and articulation between the humerus and the radius. So it is known as humero-ulnar articulation, humero-radial articulation. There are two main articulations involved in the formation of elbow joint. There is also a joint which makes the elbow joint complex, that is superior radio-ulnar joint. Yes, so the main articulations involved are humero-ulnar articulation, humero-radial articulation, and superior radio-ulnar joint. Now, let's see the type of elbow joint. The elbow joint is a hinge joint, a type of synovial joint. It has a hinge movements, only axial movements, yes, uniaxial movements, flexion and the extension. So, it is a hinge type of synovial joint. What are the articular surfaces? The articular surfaces are divided into upper articular surfaces and lower articular surfaces. The upper articular surfaces are formed by the lower end of the humerus. The upper articular surfaces are formed by the lower end of the humerus containing capitulum and the trochlea. Is the lower end of the humerus containing capitulum and the trochlea. Trochlea is presented medially whereas capitulum is presented laterally. So the upper articular surface is formed by capitulum and trochlea of the lower end of the humerus. And the lower articular surface is formed by head of radius and trochlear notch of ulna. The upper one is formed by lower end of the humerus. The lower articular surface is formed by upper end of radius and the ulna. The radius involving head of radius and the ulna is the trochlear notch of ulna. Now, let's see in the diagram. This is the elbow joint, right? This is the humerus ka lower end, humerus lower end. This is the capitulum. This is the capitulum. This is a trochlea. And this is a we have here, it is the head of radius. Here we are having trochlear notch. So the lower end of the humerus containing capitulum and the trochlea are articulated with the head of radius and the trochlear notch of the ulna respectively. So capitulum get articulated with the head of radius, whereas trochlea of lower end of humerus get articulated with the trochlear notch of the ulna. So let's see the ligaments, the main ligaments of the joint. There are three main ligaments. What are they? The capsular ligament, medial ligament that is known as ulnar collateral, and lateral ligament known as radial collateral. Here we go. The capsular ligament. The capsular ligament is nothing but a fibrous sac. It is made of fibrous. It is a fibrous sac enclosing the joint cavity. It completely encloses the joint cavity. The inner surface of the joint cavity is lined by synovial membrane. Any joint cavity containing synovial membrane. So, the capsular ligament above means above at the humerus. At the humerus level, it is attached to the lower end of the humerus medially with the medial epicondyle and laterally with the lateral epicondyle. Yes, the capsular ligament above it is attached to the lower end of humerus medially to the medial epicondyle, laterally to the lateral epicondyle. Below, it is attached to the coronoid process of ulna and annular ligament and olecranon process. Below, it is attached to coronoid process of ulna, annular ligament and olecranon process. Is capsular ligament. It is a fibrous sac enclosing joint cavity which is innerly lined by synovial membrane. Above, it is attached to medial and the lateral epicondyle. Below, it is attached to coronoid process of ulna, annular ligament and olecranon process. Now, medial ligament. Medial ligament, it is presented medially, so it is known as medial ligament. Also, it is known as ulnar collateral ligament. Is ulnar collateral ligament. It is a triangular in shape. It is triangular in shape, containing three bands. Three bands. What are they? The anterior, posterior, and inferior band. Anterior band is the strongest and stiffest band. Anterior band is the strongest, very strongest and stiffest band. Whereas posterior is, it is extended from back of medial epicondyle. It is extended from back of medial epicondyle to coronoid process. Back of medial epicondyle to coronoid process. And inferior is oblique one. It is presented obliquely. Now let's see the lateral collateral. Lateral ligament or radial collateral ligament. The ligament is extended from lateral epicondyle of humerus to the annular ligament. It is a lateral one, so it should be presented laterally. So what is lateral epicondyle? It is a it is a lateral epicondyle present in the lower end of the humerus. It from lateral epicondyle of the humerus to it is extended till the annular ligament of radius. Now let's see the stability of joint. What are the factors that maintain the stability of the joint stable? The pulley shaped trochlea fits into jaw-like trochlear notch of the ulna. Yes, the pulley shaped trochlea. See, this is a trochlea, right? The trochlea is correctly fitted into trochlear notch of the ulna, which makes a stable of the joint. And strong ulnar and the radial ligaments. Strong ulnar and the radial collateral ligaments which stable the joint. Yes. Now let's see the relations of elbow joint. Relations. Anteriorly, it contains brachialis, median nerve, brachial artery and tendon of biceps. See, anteriorly containing brachialis and tendon of biceps, brachial artery, median nerve. Posteriorly, we are containing triceps. Anteriorly biceps, posteriorly triceps. Medially common flexor origin, laterally common extensor origin. Yes, anteriorly tendon of biceps, posteriorly tendon of triceps, medially common flexor origin, laterally common extensor origin. Now let's see the blood supply, nerve supply and the movements of the elbow joint. See, the blood supply is supplied by anastomosis around the elbow joint. There is anastomosis formed around the elbow joint, formed by branches from brachial artery, radial artery and the ulnar artery. The branches of these three main branches from these three arteries form the anastomosis around the elbow joint that supply it. And nerve supply. Nerve supply is made by radial nerve, musculocutaneous nerve, ulnar nerve and the median nerve. We will discuss individually each nerve in the later classes. So the elbow joint is supplied by radial nerve, musculocutaneous nerve, ulnar nerve and the median nerve. What are the main movements of the elbow joint? There are two movements, flexion and extension. Flexion is done by brachialis, biceps brachii and brachioradialis. Yes, biceps brachii, brachialis and brachioradialis. Extension, as I said, it has only two movements, flexion and extension. Extension by triceps and anconeus. These are presented posteriorly. The posterior compartment is for extension, anterior compartment is for flexion. Yes, once again the elbow joint is it is a joint that is formed by two main articulations, humero-ulnar articulation, humero-radial articulation. It is a hinge type of synovial joint. So the articular surfaces are upper articular surfaces of capitulum, trochlea, lower articular surfaces head of radius and trochlear notch of ulna. And the ligaments are capsular ligament, medial ligament, lateral ligament. Medial ligament also known as ulnar ligament, whereas lateral ligament is also known as radial ligament. The stability of joint is formed by pulley shaped trochlea fits into jaw-like trochlear notch of ulna, whereas another one is strong ulnar and the radial collateral ligaments. Yes, the blood supply is by anastomosis around the elbow joint formed by the branches from brachial, radial and ulnar arteries. Nerve supply is by radial nerve, musculocutaneous nerve, ulnar nerve, and the median nerve. What are the movements? There are two main movements, flexion and extension. Flexion is by brachialis, biceps brachii, brachioradialis, whereas extension is by triceps and anconeus. This is complete discussion of elbow joint. If you have any doubt, please comment in the comment section, like the video, share video with your friends, subscribe to the channel. Namaste.